I will just pull in that I remember from cannabis work how many times owners would say, please don't write that down. Are you going to put that in your record? Like, can you just not say that? And I wonder if we could talk for just a quick second for our colleagues who I would say it is your medical record. It must be written down for your own ethical practice. And yet it is really easy to understand the owner's concerns. And so from our cannabis experience, I think there are ways that we can reduce their concern while taking care of what we need to do from a professionalism side. And I think that this anesthesia chart gives us that because many times we're not going to know the substance. Animal into unknown psychotropic substance. Animal presented, owner presented, unknown, and then here's the trajectory. Just like in cannabis, we go to the journal. Well, what's actually happening in the animal? Keeping sequential journal charts over time, anesthesia charting over time, I think allows us to do what we need to do, probably in an even more specific way than writing down an LSD derivative that has maybe some MDMA. Like we're not going to know that. But if we can just focus in on what's the clinical presentation, have that document, and then transition over time, I think that we are really checking our ethical boxes and our clinical practice boxes. But I just want to acknowledge how much that comes up in the cannabis side of owners really saying and really concerned, please don't write that down. Does anyone have experience they want to toss in there?
I don't know experience, but I wonder if I think and you think you kind of nailed it with like unknown psychotropic ingestion or unknown intoxication. I think that even if even if a pet guardian told me exactly what the animal ingestion, there's still there's known unknowns and there's unknown unknowns of are they telling me the whole truth? And maybe they could be, and maybe they're telling me the whole truth, but they don't even know, right? I think how we're going to approach this to psychedelic support at music festivals. People show up, you have no idea if they've eaten, drinking for the last 2 days, how many, what they've mixed, and they don't even know. And that's why this harm reduction and testing kits is so important. Um, Knowing that a lot when they do that at festivals, they find out people think their substances are pure and they're not. And so I think there's I think there's truth in that we don't know. We can't say 100% and maybe that gives you honesty and clarity in your medical report of there was an unknown ingestion possible with this. But this is what focusing on, this is what my patient is presenting at as, and that's the variety of it. And then that, sorry, my tummy's tails on my fist. Unknown component to it is always going to be there. And so I think that there's safety in that and accuracy too, if that makes sense. Sorry, yeah, I had to say hi.